Knock, knock.
Come
Hi,
on.
I'm Allie.
Hi.
I'm the PA student working with Dr. Ramsey today, and I'm just gonna ask you a couple questions.
Okay.
So, what brings you in today?
Kind of embarrassed. Don't judge me.
Don't be embarrassed.
I know. I was trying not to come in. I just it's embarrassing.
Free.
I know. It's been burning when I have to go to the bathroom.
Okay. I'm sorry to hear that. When did that start?
Maybe 4 days ago.
4 days ago.
Yeah.
So, what happened before this burning?
I honestly can't think of anything. I don't know what started.
Okay.
Yeah.
Okay.
It just about 4 days ago. When I got up in the morning, it just like sharp little stinging.
Oh, okay.
Yeah.
That sounds awful. I'm sorry it's happening to you.
I know. Thank you.
Does anything make it better, or does it happen every time?
Almost every time. I wouldn't say every time, but
Okay.
yeah.
So nothing really can make it better.
I mean, I've been trying to like not go, and when I hold it, then it's worse.
Okay.
So like, and then because there's a little bit of pressure on the old hose, you know. I know, but
Yeah.
so when I like just let it go, it's less stinging.
Okay.
But, it's nothing that I can find. I take ibuprofen, but that doesn't.
Okay, so you've been trying ibuprofen, and you don't think that this is really helping it?
No, not really.
Okay. So, have you ever had anything like this in the past?
No, I don't think so.
Okay. Is there, so you're saying this is like a sharp pain, like almost like razor blades?
Yeah.
Okay.
I mean, it stings. It's like, yeah.
Do you feel any other pain, or is it just when, like, do you have a sense of pain in that area, like, all the time, or?
Not all the time. Only when
Okay.
I pee, and it's like the tip.
Okay, just the tip.
So
Does this pain does not radiate?
No.
Okay, no. That's good. Okay, and how would you rate this pain on a scale of 1 to 10?
I would say maybe a 5, but I have a really good pain tolerance, so
Okay, so it's a 5, but
yeah. But I feel like for an average person, because I'm like a beast, so like for the normal
Of
person,
course.
it'd be a 10.
okay, 10.
But like
10
'cause
for
I'm
a
awesome.
beast, 5 for a beast.
10 for a regular
10
human.
for a layman.
Yeah.
Got it.
Yes.
Don't worry, that's important to know.
Yeah.
Yeah. I'm not gonna ask you to point to it because I know where it's. And this
Thank
is just
you.
intermittent because it's only when you're not feeling it. Okay.
Yes.
And then, do you have any other associated symptoms with this? Like, do you feel any? Are you peeing more frequently?
No. There is some discharge after.
Okay.
Like sometimes in the morning I'll wake up. It's like clear watery-ish.
Okay. And that has been beginning since the first day?
Yeah. Yeah.
Okay.
I noticed the burning first, and then I was like on high alert, so I noticed like any little So that was kind of the. So I would say about 3-4 days ago the discharge started.
Okay. Got it. 1 second here.
Yeah, you're fine.
Okay, so you have some discharge, and does that pretty much the same coincides with the urination, the pain?
Yeah, it doesn't. Are you asking if it happens when I pee?
Yeah, every time?
No. I mean, it's in the morning, sometimes at night. It's like when I'm changing, I'll notice, and I'll be like, oh, God, I'm dripping.
And that's never happened before?
No.
So there's no pain with that.
No.
Okay. And is that discharge is intermittent as well?
Yeah.
Okay. And just let me know if there's any words I'm using that you don't.
Oh, sure. Yeah. I appreciate that.
So burning and discharge are your main issues. Can you think of anything else?
No.
Okay. I'm just going to ask you some questions. So you said that you don't feel like your frequency of urination is increasing. It's just pain.
Yeah.
Okay. And are you having issue that you need to wake up in the middle of the night and increase, or no?
No.
Okay. How about urgency? Like when you have to go, you really have to go.
No, it's been about. No, it's about the same as it always is.
Okay. Do you have any blood in your urine?
No.
Okay. Any history of urinary infections?
No.
Okay. Any pain in your kidney area or in your abdominal area?
No, not really.
Okay. Any history of kidney stones?
No, thank God. I heard that's worse than giving birth. I don't know if that's true or not. Have you heard that?
I would assume not.
No.
I have not done either.
I haven't either.
Right.
I've heard it's like trying to pee out a bowling ball.
I think that's similar to birth.
Oh.
Yeah.
Okay. Yeah, they both sound horrible.
Sound bad.
Yeah.
Hopefully you never have to go through
either one. I hope so too. Knock on wood.
Have you noticed any change in the stream when you're peeing?
No.
No. How about any hesitancy? Like you're trying to go and you can't at first?
I feel like, and same with the stream, like it's only it's because of myself. Because sometimes I try not to go because I'm like, it's gonna burn, like, and I'm scared. So I hold it, and when I hold it, then the stream's like sharp, like stronger, which makes the pain worse.
Yeah. And
I feel like same with, like I'm hesitant to go, but it's not like where I'm like trying to go and I can't.
That makes sense. You just don't want to deal with the pain.
Yes,
totally
thank you.
It. Yeah. How about any dribbling?
No. Other than the discharge, but.
Okay. So I'm just gonna ask you about your social history. Just trying to see what may be causing this. So I'm gonna just ask you about your sexual history. So recently, how many partners have you had? In the last.
What's the ad?
In the last. Are you sexually active?
Yes.
First, I should not just assume that.
Yeah.
I apologize.
No, you're fine.
Give me some straight cred. I would describe your gender as
male.
Okay. And do you use condoms or?
It's hit or miss.
Hit or miss.
Sometimes it depends.
Okay.
Sometimes.
So what does it depend on?
The situation, the atmosphere. Like sometimes I'll be drinking and like you just kind of forget it, and then there'll be some times where I'm like, ooh, that person looks like I probably should wear a condom. You know what I mean? It's kind of a judgment thing.
Judgment. Okay.
And sometimes, like, if the person's like, hey, don't wear a condom, I'm like, definitely wearing a condom with you,
Right.
But, like, if they're not,
Yeah. Are you currently in a relationship?
I'm not.
No, you're single?
Single, ready to mingle.
Okay. Single. Have you had any new partners in the last 6 months?
Yes.
Okay, so in the last 6 months, how many partners have you had?
It's hard to say. This is story time. I didn't want to bring this up. I have to bring it up because it's pertinent.
Yeah.
There's this new place in Omaha. It's called Our Place. They got beds that swing from the ceiling, chains. It's weird. I know.
Whoa.
I know. Checked it out 2 weeks ago.
Okay.
Some wild orgies.
Oh, so you were involved in them?
I was.
Okay, and were you using protection at this time?
What's protection?
Condoms.
No.
No condoms. Do you have a history of STIs?
No. I don't ever get checked. I heard when I was a kid they put a pipe cleaner down your pee hole. I've been avoiding it my entire life.
So you have actually never had any STI checks before?
No.
Okay. Got it. Now I'm going to ask you some more questions. So have you noticed any weight changes?
No.
No? So your usual weight?
Mm-hmm.
Do you feel weak or tired?
Nah.
No? Notice any fevers?
No.
No. Okay. And then that's it for that. Okay. So then, do you have any allergies?
No. Actually, yes.
Okay.
Latex.
I
forgot about that. But they don't put latex in anything anymore, so.
Okay. So is that a tribute to the no condoms, or?
Most condoms I don't think have latex.
Oh, I didn't know that.
I don't actually know, but maybe that is why I don't use it. I think they have sheepskin and stuff now. I'm not sure.
I don't think you should use those ones.
Oh, why? Science.
Sheepskin.
No.
Don't use those.
Oh, okay.
Yeah.
What do you know about those?
If you are trying to prevent pregnancy, which I'm not going to assume you are or aren't, you could have a little bit of leakage in there. So I would just go strict full coverage condom. We can talk about that after.
Okay, yeah, that's fine.
I'll give you some links.
Okay.
Are you on any medications?
I am.
Okay.
I'm on lisinopril.
Okay.
20 milligrams. And hydrochlorothiazide.
Okay.
Thiazide.
So I'm assuming, is this a combination of lisinopril?
Yes,
okay.
it is.
And so how much is the high?
That is 12.5.
And how long have you been on this?
7 years.
And you're taking this once daily?
Mm-hmm.
And by mouth?
Yep.
And so you were diagnosed with hypertension 7 years ago?
Mm-hmm.
Okay. Got it. Okay. Now I'm going to ask some questions about your childhood illnesses.
Okay.
So just let me know if you've had any of the things I'm about to list off. Measles?
Nope.
Rubella?
Nope.
Mumps?
Mm-mm.
Whooping cough?
Mm-mm.
Chickenpox?
Yeah, when I was 1.
When you were 1?
Yeah. I don't remember. I've been told I had it, but
Okay.
I don't actually know.
Got it. Rheumatic fever?
No. What is this, 1800s? Like, does anyone ever have these?
Sometimes.
Oh, jeez.
You
Okay.
would be shocked.
Oh, okay.
Could also send you some links.
Well, thank you. I appreciate it.
Scarlet fever?
No.
Polio?
No.
Diphtheria?
No.
Any psychiatric disorders? Okay. And then immunizations? Were you immunized for polio?
I think so.
Okay.
Is this as a child?
Yep.
When I was a kid? I think so.
Okay.
I can't be sure.
Right.
But I think.
A long time ago. MMR? Measles, mumps, rubella?
Maybe. I can have all my records sent over here.
Okay.
I don't actually know.
Oh,
I can talk to my pediatrician.
I'll just ask about the other ones and let me know.
Yeah.
Tetanus?
Yeah, actually, yes, because I stepped on a rusty nail not too long ago. So
Oh, I'm so sorry.
Yeah, thank you.
That's awful.
Yeah, thank you.
So you had an accident. Did you have to go to the hospital for that?
No.
Oh, okay.
I just eventually went to my pediatrician.
And were you walking around barefoot outside?
It went through my shoe.
Through your shoe?
I know.
Oh my god.
I know, right?
I'm so sorry.
Thank you.
What
So
about...
pathetic.
Yeah, well, I couldn't imagine. You need to get some thicker shoes.
I know, right? Like some steel-toe boots or whatnot.
Yep. What about DPT immunization?
I think so.
Rotavirus?
Maybe. I know, I'm not very much help.
It's okay. Hep B?
Yes.
Chickenpox?
I had chicken
You had
pox,
chickenpox. And pneumococcal?
I think.
Okay, that's fine.
I
I will
know.
have my
Dr.
front
Ramsey.
desk. Dr. Ramsey will get your records so we
Yeah.
can have a more
Yeah.
comprehensive list.
Thank you, yeah.
As an adult, do you have any history of thyroid disease?
Mm-mm.
Heart disease besides hypertension?
Nope, just the hypertension.
Okay. Hyperlipidemia?
Mm-mm.
Diabetes?
Nope.
COPD?
Mm-mm.
Cancer?
Nope.
HIV?
Nope. Fingers crossed.
Wait, there's no way to tell.
No,
We've
there
never
is.
gone and tested.
Maybe that's what we'll do today at the end.
Yeah, I think that's what we are going to do today.
As long as you're not putting pipe cleaners. Is that a myth?
We'll discuss that.
Okay.
But pipe cleaner? No.
No. Okay.
Hepatitis?
No.
Kidney disease?
Mm-mm.
Blood clot?
Mm-mm.
Psychiatric history?
Nope.
And then some adult immunizations. Do you get your flu shot?
Yes.
Great. It's great to hear it.
Mm-hmm.
Flu is rampant.
Last year, but they said the flu shot didn't even work.
I heard that.
Yeah.
I think it worked for me. I didn't get it. How about you?
I did get it, but then our hospital just like flu. That's like our entire floor was flu.
Flu?
Yeah.
Okay.
So
So you work in the hospital?
I do. I'm a tech.
Okay, what kind of tech?
I work in oncology.
Wow.
Mm-hmm.
How do you like it?
I like it. It's emotionally exhausting, but
I bet.
Yeah.
How long have you worked there?
about a year.
Got it.
Yeah.
That's great.
Yeah, thank you.
Have you had a hepatitis B immunization?
I have.
Okay.
Had to have that to work there.
Herpes zoster?
Mm-hmm.
Pneumococcal?
Yep.
Yep, he's got them all. Great.
I know. On
so,
board.
You had hypertension diagnosed 7 years ago, and you take lisinopril, hydrochlorothiazide. So, do you have someone managing that, like a cardiologist?
It is my pediatrician, but now that I'm 20, she's trying to like get me out the door. So that's why I'm here, trying to get a new
Okay.
primary care doctor. And too old. Like, she was nice enough to see me the last 2 years,
Right.
but, like, after 18, it's getting awkward. Like,
So
going to the office, they're, like, sitting there with the, like, lollipops, and I'm
okay, so you
dripping from my penis.
had hypertension since you were 13.
Yes.
Okay, did you have any...
Really bad genes.
I'm going to edit that out.
It's okay. All right, keep going.
Okay, have you had any complications with the hypertension?
No, I haven't.
Okay. Any other illnesses that I should know about?
Like what?
Well, we discussed, the hyperlipidemia, diabetes, so anything like
I have been
that.
in the hospital before.
Oh, you have been in the
Yeah.
hospital. What have you been in the hospital for?
So that was, how do you say it? It was a tumor that I had removed on my back.
Oh, okay.
It was a osteochondroma. So benign. It was just like bony growth and cartilage. And they hacked that thing off.
They hacked it off.
Hacked it off.
So they did a biopsy or they just took it right out. Do you remember?
They did do a biopsy, and then I'm pretty sure they had told me at the time that osteochondroma by nature is benign, so
Okay.
I don't know, but they told me it was the size of a golf ball.
Okay. And there was no outcome or the complications?
Mm-mm.
And what year was this?
So I was 8 at the time, so I want to say 2008, is that how math works?
2006?
Yeah.
Yep.
I think so, yeah.
Any other hospitalizations?
No.
No. Any accidents or injuries besides the nail to the foot?
No.
No. Okay.
Nothing that I've been in the hospital. I'm a pretty invincible human.
Oh,
I've never really had, like, broken bones,
I
stitches.
got that because you're the beast.
I am the beast. You got
With the
that.
5 rating.
Yeah,
of
yeah.
your pain. Yes. Okay.
Maybe I have narcissistic disorder. I don't know. I've been told that.
Have
I've never
you?
been diagnosed, but yeah.
So should I put that under the
No,
psychiatric?
don't. It was just a mad ex.
Okay. So psychiatric history?
No.
Okay. So for your family history, so I'm talking grandparents,
Mm-hmm.
parents,
Yeah.
siblings, children, and grandchildren. So do you have any children?
I do not.
Okay.
Thank God. Knock on wood.
And so
Too
no
young.
grandchildren.
No. That old sheepskin doing its job.
That's good.
Yeah.
Siblings?
I have 2. I actually have 5 half siblings. They're all halvesies.
On your
So my mom has 2 of them, and then my dad has 3. Yeah, and he has them with 3 different ladies, or 2 different ladies.
Okay.
And then my mom.
Okay.
For me,
Right. So are your parents still alive?
they are.
Okay. How about grandparents?
3 of the 4.
Are still alive.
Yeah, one grandpa just died.
Oh, I'm sorry to hear that.
Thank you, I appreciate that. He died in January of. It was on the maternal side
Okay.
of heart failure.
Okay, congestive heart failure. Did he have anything else? Any other heart?
Like heart, yeah, all sorts of like his
or coronary artery disease.
hypertension, arterial sclerosis, like pretty much like anything from chronic heart problems.
Got
Yeah.
it. And what age was he when he passed?
Ooh. I want to say 72, 74, like somewhere in there.
Okay. And then for your mother,
Mm-hmm.
is she still alive?
She is.
Okay. How old is she?
She's 46. I
And
should know this, shouldn't I? I'm a bad son.
you know what?
Don't tell her I said
you
any of this.
work in oncology and you have a lot of stress on you.
Yeah.
So you can't remember everything.
I know. Well, thank you.
So your mom, does she have any history of any diseases? Anything that you could...
Hypertension.
Hypertension?
She actually even had, what do you call it? Mini strokes. What do you call it?
TIA?
Yes. She was doing her makeup. Half her face went floppy.
Oh, no.
I know. Got
I'm
freaked
sorry.
out. She went to the ER. Came
Mhm.
home. They just give her aspirin once a day or something
Okay.
like that. So
And how old was she when that happened?
that was 3 years ago. So maybe if she's 46, maybe 43.
Okay, 43, question mark.
Question mark.
And your dad? He's still alive? He's still alive?
He is.
How old is he?
He's a couple years older than my mom, so 48-ish.
Okay.
49. 5 minutes.
Okay, and he's alive and well?
Yep, he is.
And does he have any?
He's got something with his gut, like irritable bowel syndrome, and
Okay.
I don't know. He told me one time, what are some things? Not celiacs, but
He could, so celiac is gluten, so he could have a lactose allergy.
I don't know. I swear he told me one time that he was like, maybe that's what it was. He was like pooping blood, and he's not supposed to drink.
I think colitis sounds like it could be that.
Yeah, he has some GI problems. Yeah.
GI problem, got it. So I'm gonna read a list off, and maybe you can let me know if any of the people in your family have had any of these things. Headaches.
That's pretty big.
Yeah.
I mean, I'm sure they've had headaches at some point in their life.
Any seizure disorders?
No.
So the stroke, yes, your mom.
Mini stroke.
Yep.
She's very adamant. She didn't, because she's like,
TIA.
Yeah, she's like, TIA, no strokes. Like, going strong here.
Yeah.
Survive.
Any mental illness?
Nope.
Any history of suicide?
Mm-mm.
Substance abuse?
My little brother, like,
Okay.
recreationally, trips some acid now and then.
Okay. Is that a known thing? Is
Yeah,
he
my whole
seeking help for that?
No.
No? Okay.
No, maybe I'll send him your way.
Yeah, maybe you should send him in.
He just likes to lollapalooza it up and, like, you know.
Right.
He's a
How
wild
old
child.
Is he?
I don't know. He's a couple years younger than me. He's like 18.
Okay. All right. Yeah. So maybe he'll come in next.
We'll try. We've been trying to get him.
So okay. How about thyroid disease?
Nope. My brother does have a goiter right now, though.
Okay. Your half brother.
Half brother. They're all Hazzies. I'm the only like true blood. The rest are Muggles.
Harry Potter fan. I see. What's your favorite Harry Potter?
I've actually never seen the movies. I swear to God.
Oh my
Never
God.
even read the book. I have no idea.
Oh my gosh.
Have
well,
you?
should. Yeah. I mean.
Dork.
You should see the first one.
Okay.
It's
a good place to start.
Great place to start.
Okay.
Build your thoughts off that, basis off that, yeah. How about, okay, goiter, sorry, got off topic there.
I need some more
history
iodine.
of hyperlipidemia?
No.
Diabetes?
I think my maternal grandparents did, but I'm pretty sure that's just like I'm pretty sure that all old people, that's just like a qualification to become old. You have to have diabetes.
No, but yeah.
Yeah. It happens.
It
it's
happens.
Common.
It's common.
Yeah.
But that's not the definitive line.
Okay.
Yeah. Asthma?
No.
Okay. Tuberculosis?
Mm-mm.
Renal disease?
I don't think so. I was trying to think of my grandpa if he did blow out his kidneys, but I think he was all right. Because that happens with hypertension, you know?
Right, yeah.
They were worried about that. They kept a
Right.
close eye on that.
Right.
But no, I don't think.
Okay.
Like, he was never on dialysis or anything
Okay.
like that.
How about arthritis?
No.
How about any allergies?
No.
Cancer?
Grandma had breast cancer.
I'm sorry to hear that. I'm assuming
She
did it?
Yeah, she did.
That's great.
Yeah.
Do you know what age she was when she had that?
She was in her 60s.
And this is your...
Maternal.
Okay.
I feel like everything's my mom's side. God, they're falling apart.
Sometimes happens with aging.
Yeah. No, yeah.
How about any other genetically transmitted diseases?
No.
No? Okay. And then for surgeries, the only surgery you had was the removal of the benign?
Yes.
Or did you have more surgeries?
No, that was the only one.
Okay. And then I just have a quick few questions about your social history.
Sure.
Okay. So, do you typically drink alcohol?
I do.
Okay. How often?
I would say a glass or two a night. A lot of stress. I'm in PA school right now, so I have a lot
you
of
work
stress.
at an oncology tech and you're in PA school?
I am, yeah.
How are you managing?
I don't know.
Do you do anything for self-care?
I go to weird parties with beds hanging.
Let me see. we still have 4 seconds, whatever.
Well, do you need to keep going to edit stuff out?
Yeah, fine. Okay. So 2 glasses of what each night?
The last couple nights, it's been Tito's. I've been doing Tito's and water.
Tito's and water.
Yeah.
And how, like, in what size glass are you
So the glass is about this. Tito's, I do about 3/4 splash of water.
Okay, so a lot of Tito's.
Yeah.
Little water.
Yeah.
Okay. And this is every night, you're saying?
Pretty much, yeah.
Okay. Any illicit drugs?
No. Viagra?
Are you prescribed Viagra?
I am not.
So who's giving you the Viagra?
I'd rather not say.
Are you obtaining it from a...
It's...
Is this like a over-the-counter, like, prescribed
from my
Viagra?
dad.
Or are you getting
it's
it
my
from...
dad.
Okay.
Yeah.
Your dad's. I thought you were getting it offline.
No. My
Okay.
dad is prescribed it.
And you're taking this because you have issues with erectile dysfunction, or you just
It's for recreational use.
Okay. And this is not prescribed to you?
No.
And how often are you taking it?
Not that often. It's like, I don't know, once every couple of months.
Okay.
But the only reason I brought it up is because I'm worried because of my heart. I have hypertension, so I wasn't sure if that was something that, like, if that's a big no-no, or...
I'm thinking since you don't have any erectile dysfunction issues, we should maybe just axe that completely.
Uh-huh.
But we're going to save that for our next visit.
Okay, yeah.
But don't take it before
Okay.